matter what, we come together for the good of our constituents, and I'm proud and honored to lead the People's House of the New York State Legislature.
The health and protection of the human beings that live in our districts is our responsibility.
Senator Douglas's words for us today, I quote, "If there is no struggle, there is no progress."
If you want equity to happen, then this is where it happens.
All of us have a responsibility to the greater good.
The House will come to order.
Greetings. My name is Assemblywoman Solages. It's a pleasure to be joining you to discuss some important issues, and I thank you for tuning in. I have two important guests here with me, and you know, all you guys know that I really care about healthcare and making sure that people have adequate access to healthcare. And so when we talk about conditions and disorders, it's important that we raise awareness about certain conditions and disorders. So today, on the floor of the New York State Assembly, I passed a resolution to declare May 7th through the 13th Fibromyalgia Awareness Month. And so when we talk about this disorder, it's something that at times people are suffering from this condition and they don't even know because there's not enough research about it. And so I have two guests that's been working with me for years, right? On raising awareness about fibroids. And so I have Phil and Sue with me, and you know, I want to give you an opportunity to introduce yourselves and give greetings to the wonderful viewers that we have here.
Go ahead.
Sue can go first. Ladies first, right?
I'm Dr. Sue Scheib. I'm chair of the Fibromyalgia Taskforce of New York State. But I got here because I'm a patient. I'm not a medical provider or have not studied medicine at all. Although I've found out that if you have a disorder that nobody knows too much about, you do a lot of your own research. And I think that when we talk about it, we want to educate patients as well as the general public. I got to this by having a illness that couldn't be diagnosed for 7 years. It was misdiagnosed as a brain tumor and other things along the way. So I am happy to be here to be able to help others along this journey.
And we thank you so much for, you know, giving your time and effort for awareness. It's appreciated. And then Dr. Phil, from what I
Hello, I want to thank you for having us on today, and we can discuss fibromyalgia as a problem in society. Part of what we're doing with our task force is trying to raise awareness of fibromyalgia. It's been a well-diagnosed condition in the medical community, but we still have clinicians who underdiagnose or don't really believe the patients. And from the research side, as a researcher, I know that there's definitely physical ailments that go into fibromyalgia. This is not just a psychosomatic, all-in-your-head type of a disorder. And the point of the Fibromyalgia Task Force and the New York State Fibro website that we're trying to get in line here is to raise awareness both for clinicians and for patients so that we can have a centralized sort of repository for both data and also clinical avenues to explore, because as Sue sort of pointed out, many of the patients still suffer from inadequate care, and fibromyalgia and many other idiopathic conditions still remain with unmet medical needs.
And so the biggest challenge is that people are commonly misdiagnosed, as you said. So what are some of the symptoms?
Well, pain is the primary symptom with fibromyalgia. The secondary symptom would be extreme fatigue. But then in addition, there are about 28 other symptoms, including TMJ, irritable bowel syndrome, and many others. So any patient will present probably a little differently because of the constellation of the symptoms that they have. They may have 5 or 6 symptoms, and somebody else may have a different ones, but the primary symptom is pain. And
so there's about 400,000 New Yorkers that are currently properly diagnosed with this, but could there be more?
Oh, many more, I feel.
Potentially, for sure. And some of the research that we did at our company, Integrated Tissue Dynamics in Rensselaer, New York, we published some research about 10 years ago now and showed specifically pathology in a fibromyalgia cohort. And what we're now seeing is that this constellation of effects, as Dr. Scheib described, with fatigue, pain, cognitive dysfunction, we're seeing a lot of this same symptomology creeping back into society from long COVID patients and from vaccine injury patients. And we've seen this in other publications and research that we've done at our company, where we've seen underlying pathology that seems to mimic the same symptomology. And so now with this creeping back in of the long COVID conditions, we have in the research world sneaky suspicions that there may be a similar pathology underlying these. And chronic fatigue is another one. Irritable bowel, as has been mentioned. There are several disorders that may have similar underlying pathologies that we think we've possibly made some discoveries toward, which will really benefit this community who has, like I said, been underserved, and the treatments and the therapies that are available are really not very well tolerated and very effective.
And it's great that you are organizing a task force and organizing information, because in this world of misinformation and abundant knowledge through the internet, it's easy to fall into a rabbit hole, right? But it's nice to have peer-reviewed sources. And so tell us about the journey that you've taken to ensure that people have access to quality information.
Well, we began about 2007 with, just like today, Fibromyalgia Awareness Week in New York State. And we received a grant, and from that grant we had 4 days that we met with physicians, attorneys, business, patients, therapists, a broad array of people. And from that we produced a booklet about fibromyalgia awareness, and we have distributed about 6,000 of those.
That's excellent.
We also have free download on our website. So I have developing a specific website for fibromyalgia. That was been our latest dream, and now today it's realized. Today we launched this website.
Oh, congratulations! And so, what's more? Can you tell us more about this website?
The website is divided into 2 parts, really. The first part is specifically for the clinicians, in that the whole website is for physicians, but it's specifically for physicians in that it's the actual research, and it's current research. It's selected, Dr. Albrecht selected the research himself from that. So it's quite extensive research to show what possible avenues may be contributing to this. And from that, we hope we can derive some treatments.
That's excellent.
The other part is a part that's written from a patient perspective, in that it's a sort of a collection of treatments that you can offer to your patients that are other than pharmaceutical in many cases. And some other information about small fiber neuropathy, which was discovered by Interdyne, that is now believed to be the cause of up to half of the cases of fibromyalgia.
Wow.
So this also is expanding the number of symptoms we can look at, because fibromyalgia patients who come in who have also have small fiber neuropathy will have many other symptoms that contribute also to the fibromyalgia.
And so nyfibro.org, you said it's mainly for physicians, because there is a challenge, right? They might not understand or know about this, right?
Correct. That really is sort of the focus of our website, and as you mentioned, nyfibro.org. We still see that continuing medical education lacks fibro awareness. We still see patients talking about going to their physicians, and their physicians not fully understanding the disorder, the complex disorder that fibro presents itself as. So the point of the website is, as you pointed out, there's so much information now that's available at your fingertips, much of which you don't know whether you can believe it or what you should believe or what you can read. So the nyfibro.org website is going to be a place where we'll curate it with the experts in the field. There are many theories of fibro. There's much research that's going on, and it's hard to wade through that. And so this is an opportunity to create a centralized place where clinicians is the main focus, but also patients and other researchers can go and respect the site as what the information is there. And we're going to try to curate the site with the experts themselves, possibly do some interviews, have the researchers describe their work in their own words, little ways to make it, you know, in today's information technology, people want their information in tidbits. They want
Correct,
a little quick, you know, a Snapchat video or something. So we're going to maybe try and do things like that for the clinicians, 10-minute, 5-minute quick snippets of what the research, the latest things, particularly with treatment. And as Sue pointed out, for certain fibro patients, it's a complementary of treatment. You don't need one physician, you need a team of physicians that are treating the entirety of the person, not just the symptomology itself.
So what's the future of fibroids? Like, what's the future of ensuring that people have access to quality care and that clinicians also understand?
Well, we know that there's a 17-year gap from research to practice. So we're trying to close that gap to bring the current research to the physicians in a user-friendly manner. That I see as part of the future. Also, I hope this will continue to bring more attention to it so that medical schools start teaching more about it, teaching about pain, but also about fibromyalgia and related illnesses.
So this was not your first go-around. We've done this resolution many times. The only thing that stopped us was the pandemic. What does raising awareness mean to you?
Well, again, this is a long road in that, as Sue pointed out, we started in 2007. In 2009, we held a large fibro organizational meeting with clinicians and researchers and caretakers and providers, and we put a booklet out, and we're now, 10, 12 years out, and unfortunately much of what was presented at that meeting 12 years ago is still very relevant today. And the awareness is out there, but it hasn't grown the way we want it to grow. And so this type of an opportunity, the awareness that you can bring from New York State, will really help kind of continue this. We're trying to get the snowball effect going, where the more awareness will create further awareness. And as Sue pointed out, this is something that we would really like to see brought into medical schools at the early medical treatments, early medical teachings in the first and second year, so that the medical students go on, and when they do then see these patients, they're aware of these conditions and they're able to treat them better.
We'd also like to improve the conditions for fibromyalgia patients. Sadly, because it takes so long to get a diagnosis, many times jobs are lost. Sometimes insurance is lost. Spouses or significant others are often lost. Homes, I've seen homes be lost due to this delay in diagnosis. And also, we need employers to be considerate of the limitations of people who have fibromyalgia. They can still work, they can still do many things, but they may need some accommodations, and this is very important.
Well, I thank you for all your service, and I look forward to seeing you next year, right? And I think we need to continue the dialogue, educating legislators, constituents, as well as physicians. So I appreciate your work. Thank you.
Thank you
very
very
much.